Hot, cold, wet, dry, sweet, bitter, salty, acrid, sour. What do all of those mean? When you first started or are starting to become interested in herbalism, probably the first thing that you did, which is the first thing that everybody does, is to look up herbs and to read about them. I mean, that seems pretty straightforward, right? And when you did, you undoubtedly saw herbs described in a lot of different ways. Probably there is some kind of biomedical adjacent term like anti-inflammatory or antibiotic or something of that nature. Or there's a description of action, like this herb treats cough, or this herb treats painful periods, etc. And you might think, well, okay, that's great. So now I know a little bit more about this plant. But after a moment, when you stop to think about it, you might wonder, well, does that really actually tell me anything? I mean, there's got to be more to it than that, right? I mean, saying that an herb treats a cough is pretty cookbook medicine. And isn't herbalism supposed to be the opposite of that? Isn't herbalism supposed to be holistic? So something's missing, right? So then you read a little bit more and you see that all of these herbs are categorized in particular ways. And these ways are kind of strange, but also kind of intuitive at the same time. And that's where we get into the hot, cold, wet, dry, and sweet, acrid, or spicy, and salty and sour and bitter, and maybe some other weird classifications depending upon what you're reading. And then maybe you think, well, what does that even mean? Or you might think, maybe that says something about what kind of cough it treats. Maybe there's, if there are herbs that are treating cough, and some of those herbs are classified as hot and some of them are classified as cold, well, maybe there's a cough that's hot or a cough that's cold, just like there can be a wet cough or a dry cough. And so then maybe we think, now we're getting somewhere. Now we're starting to make sense of things. We're seeing how the herbal description kind of plugs into a descriptive framework of pathology. And you kind of are. You definitely are in a way. But there's a big problem with this. And that is, when you first start exploring herbalism, depending upon what you're looking at, you might think that all of these descriptions are part of the same thing. And that's exactly how the information is presented, without really any kind of context of where this information comes from. What is hot? What is cold? What is sweet? What is salty? What is bitter? What is sour? Etc. And so that can lead one to think that herbs have some kind of universal quality to them, that herbs just simply are hot, or they simply are cold, or they are sweet or sour. And of course, we taste an herb and we think, well, that's sweet and that's sour. And we kind of think, well, we take it for granted that that's just the way that it is, that there are these universal qualities to things. And so it seems like herbalism is some kind of a unified field or tradition that is monolithic and everything is more or less agreed on. But this could not be further from the truth. And when it's presented like it is, which is more an error of omission than anything else, it naturally leads to some real confusion. And it can make you feel like you don't really understand what's going on, or maybe you're not capable of understanding the information. And worse yet, it creates a kind of lack of internal coherence that can make the whole field itself feel untrustworthy. So, I understand your confusion. I was right there with you. We all start from that place. So I guess I'm making this video to reassure you that you are not alone. in feeling a little confused by what these descriptors mean, where they come from, and why a lot of the times nobody can really agree on them. One text will say one thing and another text will say something that's completely different. So again, this is all kind of presented as this monolithic field of herbology where things are demonstrably provable, that herbs are definitively hot, or they are definitively cold, or they are definitively sweet, or definitively sour, or acrid, or etc. And this really comes directly from pop herbalism. And pop herbalism lacks intellectual rigor, and it loses the specificity of the historical traditions that these herbs are coming from, and the descriptions that are found in these historical traditions. So it's sloppy, and more to the point, it's bullshit. And it makes you feel confused and like you can't really trust what these descriptions actually are. So they're no longer useful. They're just kind of these add-ons in a way. They make you feel like you're connected to some kind of esoteric rationale and reasoning, while still really just kind of prescribing things or thinking about things anyway, more or less from a biomedical point of view. And that's kind of sad and not where we want to be if we're using herbs, because the biomedical point of view doesn't describe things enough to really let you know how to use them. So let's try and clarify some of the issues here, where the terms come from, what traditions they come from, why they are what they are, and how not everything is equal. And so this is going to be really important. So first off, we have these terms. Again, we have hot, cold, wet, dry, acrid, bitter, sour, sweet, and salty. And they all come from different traditions. And they all mean something very different in those respective traditions. By that I mean they plug into their own original theory in really specific ways, and means they don't plug into other theories in the same way or at all. And therefore, when you casually mix terms of an herb is described in one way in a particular theory and it's described in another way in a different theory, it can not only be very confusing, it can be very contradictory, which can lead you to wonder, how are you actually supposed to understand something, and how are you actually supposed to use it? So don't get frustrated trying to make sense of things that are borrowed from traditions separated by hundreds or thousands of years, thousands of miles, and completely different cultural experiences and medical theory that somebody, for some reason, thought would be a good idea to just mash all together. And so, in other words, don't get frustrated when a book says a particular herb is cold, and then another book says that particular herb is hot, and others say it is both cold and hot. Instead, let's take a look at where all these concepts come from. Let's put them back into the herbal systems that they belong in, because nothing makes sense out of context. So we're going to compare three major herbal systems in terms of how they classify herbs and what it means for how they think about the herbs and what they do. We're going to look at classical humoral herbalism, classical Chinese herbalism, and modern Western herbalism. And we could definitely throw Ayurveda into the mix. I just don't know enough about Ayurveda to really talk about it. That doesn't mean it's not one of the major herbal systems, because it definitely is, but I don't want to misrepresent it. So let's start with humoral medicine. Now, in classical humoral medicine, you have four different qualities. Two are based on temperature and two are based on moisture content. So you have four different possibilities. You have hot, cold, wet, and dry that combine into hot and cold, hot and wet, dry and cold, and dry and wet. And whether something was hot or cold in humoralism, or wet or dry, depended upon the effect it had upon the body exclusively. So it didn't matter what the herb felt like what it tasted like, for example. It was only what it did to the body. Before we get going, let's pause for a real quick after-the-fact interjection, because when I explain classical humoral classification, it might seem a little contradictory compared to other things we may have heard, we might assume, or have read. And apologies for my voice. I picked up a cold while I was making this, so hopefully everything comes out okay. So I'm about to explain that classical humoral medicine did not classify its medicinals according to taste. It only classified them according to temperature and moisture. And this is true, but this doesn't mean that taste wasn't present in humoral theory at all. It was, but importantly, it was not used to classify herbs. And this means that you would not pick up an herb, or you would not pick an herb for a treatment or a formula, for example, based upon its taste or flavor profile. You wouldn't be thinking, I need a bitter or a sour or a salty herb. I mean, you would to a degree. That would be more or less a kind of secondary line of reasoning, but it wouldn't be the first thing that guides you. The first thing that guides you would be the taste and the temperature and the moisture quality. And this is very different than, for example, classical Chinese medicine, where the formula was entirely composed of flavors. That's how the formula was thought of, and that's why particular herbs were picked. Of course, they were picked according to effect, but effect was a subgrouping of flavor, essentially. And so in Chinese formulas, you would see primarily flavor used as a way to compose a formula. It dictated the therapeutic effect, but also it was the way that a formula was balanced. So what this means is that in Chinese herbalism, flavors are both how you describe how an effect happens and how you select for an effect. And within the formula architecture itself, it's how you balance out the entirety of the formula to mitigate side effects. And this is because every flavor has an effect, and that effect is going to be either positive or negative depending upon the body that you're putting that flavor into. It's going to bring you into balance. It might take you out of balance. Some things are stronger than you need, some things are not strong enough, but you still want to use those herbs because of the particular effect that they have that maybe another herb doesn't. So what this means is that half or more of a typical classical Chinese formula is the balancing of flavors to either strengthen one effect of a formula or reduce the effect of another part of a formula, or balance some other body system that needs to be co-regulated when you're treating something. Or it's just to prevent side effects and prevent any kind of collateral damage that happens in your formula. This is not how humoral medicine worked. Humoral medicine did also balance formulas, and they were quite concerned about side effects, how the herbs worked together, very mathematical in their degrees of how hot something is, how cold something is, for example, and in looking at how warm or cold a condition is and how you properly match that. So they're very, very concerned about that as well. But they just didn't frame that in terms of flavor. They framed that in terms of temperature and moisture. So taste in humoral medicine was described as the how an herb is the temperature and moisture it is. So essentially it is, you have an herb that's hot or you have an herb that's cold. Why is it hot or cold? And the justification was that it was hot or cold because of its flavor. Same thing with moist or dry. It's all because of the flavor. So flavor was seen as the justification for how an herb could do what it did. Taste was essentially the intersection or interface between an herb and a body. This also importantly meant that if you didn't know what an herb did, you could guess at its effect by tasting it. But it's important to keep in mind that guessing at what an herb does based upon how it tastes was never an absolute. You guessed at what it did, and then you confirmed that guess through observation in the body. And also, there is the difference between herbs with a singular effect. For example, herbs of a singular quality that have no competing effects within them. So like herbs that are singularly hot or singularly dry, for example. You could more reasonably guess at what an herb does if it was a simple herb. But you would have a much more difficult time if the herb had competing effects. So if an herb was hot and cold. Now, importantly, this doesn't mean that the herb is hot and cold at the same time. This is something that occurs in modern Western medicine later. What it means is that given certain conditions, certain aspects of the herb being hot or certain cold aspects are brought out within a particular body. And that depends upon preparation method, essentially. So whether an herb was hot or cold didn't depend upon the body you're putting into. It depends upon how you're administering it. So in those cases in which there are multiple qualities of an herb, you would have a much harder time guessing what the actual effect of the herb was going to be just based upon the flavor. So keep that in mind. And importantly, taste never told you also what the specific effects of the herb were. It just told you, here's the general idea of what this thing's going to do. Each medicinal was unique in terms of its effects, and it had to be understood in its own terms, and that was through observation. Of course, there were general effects, like bitter is generally seen to be cleansing because bitter is the taste of yellow bile, and yellow bile cleanses by heating. But those were general actions and not specific actions. This approach held up until the Renaissance, and in the Renaissance, so between 14 and 1600, physicians like Jean Fenel and Andrea Casalpino argued that it was, in fact, the specific flavor of a medicinal that determined its specific action of effect. But prior to that, the theory was not so set in stone and so elaborated upon. And I'll link more about them in the description below. And that's all part of a longer conversation, but hopefully that clears up any confusion that might arise out of what I am about to say next. So something was hot if it sped up body processes. So if it makes you have more frequent bowel movements, or if it increases urination, if it makes you sweat, if it increases heart rate, if it gives you more energy, then it is going to be warming. If it makes you cold, it's going to be doing the opposite things. So if it slows heart rate, if it slows digestion, if it inhibits sweating, and if it makes you cold at the surface, and if it makes you feel more sedated, then you're going to classify that as something that is cooling. Something that is wet is something that has an effect upon tissue state of increasing moisture content. So this is especially observable on the mucous membranes and skin, but also in the joints and the lungs, and also in the quality of the muscles in general, how tight a muscle is, whether it's relaxed enough to allow proper blood flow into a muscle, the capillary system's not closed off due to muscle tightness, stuff like that. And something is dry if it dries out the tissue states, so if it clears things like mucus and phlegm. Also, if it takes like atonic muscle conditions where there's kind of muscle flabbiness, or maybe like a flabbiness of the skin too, like some kind of superficial edema. If it tightens that up, it's going to be seen to have a drying effect. So those herbs are described by the observable effect that they have on the body. Now, this is a really quick and incomplete way of describing humoral medicine's classification of herbs. It's what cold, hot, dry. And if you want to go more in depth in that, then you can check out the full video I did on humoral herbal energetics. But moving on, in Chinese medicine, so Chinese medicine is different. It describes things in terms of both the observable effect an herb has upon the body and also its organoleptic properties. And it attempts to use organoleptic description as much as possible to explain the effect on the body. So, what is an organoleptic quality? This is simply what your senses can perceive. So, this is the taste of something. This is also the smell of something. And it can be the color of something as well. And this is actually a very intuitive way of describing herbs because it uses your sense organs as a kind of laboratory. Plant chemicals that exert a particular effect upon the body, generally speaking, have a similar molecular structure. This means that they also often have a similar taste. And less reliably, they may also have a similar color. So let's take an example. Strongly antibiotic herbs tend to be strongly antibiotic because of their bitter alkaloids. These alkaloids are both distinctly antimicrobial and distinctly bitter. Bitter also tends to have a sedating effect upon certain aspects of the nervous system. Sweet herbs are sweet because of the triterpenoid, saponins, and glycoside content. Sour herbs generally have an astringent quality because of organic acids. And salty herbs are a little bit harder to relate to, but in terms of energetics, they have a dissolving effect. So they are things that reduce accumulations and break down masses. Acrid herbs, which are aromatic and spicy herbs, have a general warmer mouthfeel and are also stimulating. So you have 5 different ways of describing an herb based upon its flavor profile, which correlates to its molecular structure. Bearing in mind, plants can have multiple flavors. And of course, this is something that is observed and correlated over time with specific herbs in the Chinese materia medica. And some things are obvious, like an obviously bitter herb like coptis, which contains berberine. Or something that's sour, like Japanese apricot or schizandra. Or something like licorice, which is inarguably sweet. And so you can say that these herbs are bitter, sour, and sweet respectively, and then you can draw the conclusion that it is the flavor that somehow creates the effect, even if you're not quite sure how it does it. But we have to be careful here because the grouping herbs by their organoleptic qualities in Chinese medicine is really more descriptive than it is predictive. And by this I mean, with a lot of herbs, things that the flavors are not, you're not quite clear on them, you'd be really hard pressed to guess what those flavors are. Would you be able to guess that peony root is sour? Or that gypsum and turmeric are acrid, in addition to other flavors? Probably not. So the system seems like it should be predictive, like you feel like you can taste a flavor and guess what it does. And while you might be more right than wrong, being just a little wrong is not what you want to do if you are ingesting something internally. So while the system seems like it should be predictive, it's actually descriptive. It's a way of organizing information to help you understand why a plant does what it does, which tells you how to use it. So it's an organization of function into a category of flavor, and that category broadly matches actual pharmacological effect, but not always. It's kind of a pharmacodynamic metaphor, if you will. The taste mostly lines up, especially when it's obvious, but it doesn't always. And this is also, importantly, why flavors can change over time. So let's pause for a quick little interjection here, because I wanted to give an example of an herb changing flavor over time. And one of the best examples is Mahuang, or otherwise known as Ephedra Sinica. That's its taxonomic name. For those of you that don't know or want a little bit more background on ephedra, ephedra contains ephedrine, and ephedrine is a bronchodilator and sympathomimetic. So that means that it opens up the lungs, it opens up the bronchioles, and it makes you sweat, and it does this by stimulating the central nervous system. And this effect is also what is exactly described in classical Chinese medicine too. That's ephedrine, and from ephedrine you get pseudoephedrine, which is a stereoisomer, which is less stimulating, therefore less harsh. Now, the sordid history behind ephedra is that ephedra was used by supplement companies in the 90s for weight loss supplements, essentially, because it is a CNS stimulant, which means it suppresses your appetite, and it just increases overall activity of a person, so they're burning off more calories, essentially because people are doing speed. So supplement companies used ephedra in the 90s for weight loss supplements, and they combined ephedra with a bunch of other garbage, toxic things, and as a result, predictably, people died. And so the FDA banned ephedra. And that is a really good reason why you should be very cautious of the supplement industry. In general, most companies, I'm sure there's some good companies out there, but on the whole, not really caring too much about your health. And pseudoephedrine has its own sordid past in that it was used to make meth, and so then it became by prescription only, no longer any over-the-counter. Okay, so now what is the point of this anecdote? The point is to illustrate a changing history of flavor profile of Mahuang or ephedra. So, in the Han Dynasty, which would be about 1800 years ago, Mahuang was classified as sweet. Now, the sweet flavor in both classical Chinese medicine and classical humoral medicine is building, specifically. It generates fluids, it generates substance. And I mean, this is a no-brainer, right? You eat a lot of sweet things and you get fat. But being something that causes profuse sweating and opens the lungs and is excitatory, that's not the characteristic of a sweet thing. That's rather the characteristic of something that would be labeled acrid or pungent. So at some point, Mahuang was reclassified from sweet to acrid to better fit the observed effect of what it was doing to the body, and also probably because it made more sense within the descriptions of its usage in formulas and formula architecture. So, what happened? The flavor didn't change. It's not like one day somebody tasted Mahuang and they said, holy crap, that's not sweet anymore, that's acrid. So the flavor didn't change at all, of course, but rather it was the conceptualization of Mahuang or ephedra that changed. So flavor is not constant. I mean, of course, what you taste in an herb is constant, but flavor as a classification is not constant. It changes across time and place. and it changes between different theories. And this is really important because you need to know this. You need context. You need history. And if you're looking for a particular flavor for a formula, that the flavor of that herb has to be classified correctly for your specific theory. And this means that you can't take the flavor of an herb as any kind of guiding force as it exists in a different theoretic system and then import that into whatever your target system is. So if you're using one system and you're picking an herb as it's described in a completely different herbal theory, system of herbal theory, that's not going to match. Flavors are conceptualized differently in different systems. They do different things. So again, if you pick an herb based on a description on one system and apply it to another, thinking the terms match, thinking you know what's going on, you're going to be wrong, and you're going to make a mess of yourself or somebody else, and you're going to be confused and frustrated, and is going to cause a lot of doubt in what you're doing. Another key example is sour. In modern Western herbalism and classical humoral herbalism too, sour is cooling. However, Chinese medicine doesn't say that sour has a temperature at all, and we'll get to that in a little bit. But in Ayurvedic medicine, sour is specifically warming. So that means if you grab an Ayurvedic herb because it's sour, thinking you need sour, and thinking you know what sour means, or know what sour means in Ayurvedic medicine because you know what sour means in modern Western herbalism, you're going to be wrong. The herb that you're going to be grabbing is going to be doing exactly the opposite of what you want it to be doing. So you're going to make a mess of things. So, at any rate, that's just a quick example of how tastes change over time and how they're not the same in different systems. So, hope that helps to make sense of things. And now, back to where we left off. So, let's get into some pharmacological justifications for the flavors. Bitter herbs, as said, contain bitter alkaloids, and these are generally antimicrobial, antipyretic, and anti-inflammatory. You can see that bitter in Chinese medical terms has a kind of draining effect. And this draining effect can map to what we call cold. And insofar as excess heat in the form of inflammation is irritating, bitter herbs can be said to be relaxing. And many bitter herbs are cold for this reason. So bitter, heat-clearing herbs from a Chinese medical point of view often have a nervous system downregulating effect to certain parts of the nervous system. Of course, whether that's sedating or not depends upon who you are. If you're revved up, bitter will tend to calm you down. If you're already cold, bitter will make you vomit and crap your pants. Sweet herbs are generally sweet, not so much because of sugars or polysaccharides, but more because of the triterpenoid saponins, glycosides, flavonoids, and amino acids. And even though they are not sweet in the sense of eating sugar, the flavor profile still does have a building effect upon the body. This works on the receptor level, triggering anabolic hormone release, like through insulin. And the other constituents, the polysaccharides and saponins, act as trophic signals that stimulate cell growth and bind water into tissue directly. So sweet is seen as building fluid and tissue. Sour has an astringent effect that is noticeable upon the mucous membranes primarily, like when you take vinegar. It's also seen in the effect of puckering lips when eating a lemon. And it's also the very same thing in the quality of sour causing muscle relaxation, like white peony root causing muscle relaxation, for example. Salty, again, has the effect of dissolving things. And this is a lot harder to conceptualize. But you can think of it kind of like salt dissolving in water, or salt water causing something to rust. It causes things to break down. At least that can be kind of a helpful metaphor. And this is used to describe the flavor category of herbs that reduce hardness or masses over time. So a lot of blood-moving herbs and herbs that address masses in Chinese medicine would be described as salty. And lastly, acrid and spicy herbs have a warm or hot sensation. And this relates to their TRP receptor activation. And the TRP receptor activation activates the sympathetic nervous system and causes excitation in the body. So we see how different organoleptic properties map to specific physiologic responses. Now, these physiologic responses can in some ways relate to concepts of hot and cold, in that acrid and spicy herbs will be excitatory, and you'll also get a warming mouthfeel or warm sensation. And we could say bitter herbs do tend to be sedating and clearing, so you could make the argument that they are by and large cooling. But this is important. In Chinese medicine, the flavor of the herb does not guarantee the temperature. This is not a one-to-one correlation. Not all acrid herbs are warm, and not all bitter herbs are cold. So the system describes flavor and temperature in two different axes of effect. You have both taste and temperature. A taste is a general effect, and a temperature is an independent measure of excitation. So, for example, acrid herbs make you sweat. They often open the capillaries, they open the pores. If you get hot when you sweat, then the herb is acrid and warm. If you get cold when you sweat, then the herb is acrid and cold. And this is a key difference between classical humoral medicine and classical Chinese medicine, because remember, in classical humoral medicine, whether something was hot or cold related to purely the effect that it had upon the body. Did it speed things up or did it slow them down? And in classical Chinese medicine, you have both the effect that an herb has upon the body and then also the excitation aspect of it. And so this is why you can have two different herbal systems that describe the same herb in an entirely different way. For example, take mint. In classical humoral medicine, mint is classified as warm. It's classified as warm because it is seen as having a stimulating effect. If you take enough mint, you will break out into a sweat. Clearly, you have to take a lot more mint than you would, for example, something like ginger. I mean, it's not a strong diuretic. But if you do take enough, you will sweat. So it does have an excitatory effect upon the body from when viewed in a classical humoral framework. Therefore, it's classified as warm. But in Chinese medicine, mint is classified as cool, and this is in large part due to the organoleptic property, which is you have a cup of mint tea and your mouth feels cool. You breathe in the vapors from the mint tea and your sinuses cool down, or you put menthol on the body and then your skin feels cold. So it's the felt sensation of the body, but it's also looking at how the effect of mint makes you feel. So mint is a diaphoretic, it makes you sweat, but the effect of that sweat is to cool you down. So contrast that with ginger, which is also diaphoretic, but it heats you up. So this points to the observation that not all sweating is warming. So this is different than the humoral conceptualization, where sweating is an excitatory effect. In Chinese medicine, sweating can go either way. It can be hot sweating or cold sweating. So that's a major difference. And Chinese medicine also says that mint is both acrid and cooling. So acrid does not automatically mean warm. So it keeps things on two different axes. So humoral medicine says that mint is warm because it's stimulating. And modern Western herbalism also says that mint is stimulating. So in some ways, you have to wonder about the influence of older classification systems onto modern. The classical humoral system influencing the modern Western herbalism. And this is important because a lot of confusion can arise because of this. Because classical humoral herbalism has its own medical theory that is completely independent of modern Western herbalism. So if you're having an older medical theory and herbal classification influencing a modern and completely different medical theory and herbal classification system, it's going to create some kind of general confusion or maybe false equivalence of this does this because of this. For example, Greaves, a modern herbal, defines mint as a stimulant, particularly of the digestive system, and specifically states, peppermint is good to assist in raising internal heat and inducing perspiration, although its strength is soon exhausted. And this is close in thinking to humoral medicine because warming, as a humoral medical term, implies purifying. Impurities are cooked out of the body. That's one of the functions of yellow bile. So warming here has the same kind of meaning of restoring proper function. It's not a temperature necessarily. It is something that restores the way something's supposed to work. It purifies. And that means it gets rid of dysfunction. But we have to be careful here because Greaves Herbal and most of modern Western herbalism is, for better or worse, not really rooted in classical humoralism anymore at all, but is much more closely aligned to modern physiology and modern pharmacology, even if at times it uses humoral terminology or concepts. And so the problem is that in modern pharmacology, you'd think that warming, what we just described mint as, induces feelings of heat because spices act on specific trip receptors and cause a feeling of heat, and they are excitatory of the sympathetic nervous system, irrespective of any kind of idea of restoration of function. So, to my mind, when herbs are classified as warming in modern Western herbalism, we have to be careful we know what that really means. And be careful there's not a kind of conflation of terms. Is warming restoration of function as it was in classical humoral medicine? Is it the organoleptic quality? Because modern Western herbalism definitely describes herbs as warming based upon their organoleptic quality. So we have to be really careful about what we're actually talking about, because sometimes you want to restore function with an herb that you don't think is warming at all. And if you reach for a warming herb in a case where treating it with a cold herb is what restores function, then you're kind of confusing concepts a little bit. At any rate, getting back to Chinese medicine as a way to contrast, Chinese medicine says that mint is not warm and that it is not inherently stimulating at all, and that is in contrast to, for example, Greaves Herbal. And the perception of stimulation depends entirely upon the underlying state of the body. So, mint moves stagnant qi, and in particular, stagnation of liver qi. And when a person has liver qi stagnation, there is a tendency towards simultaneous irritability and fatigue because your qi is not circulating smoothly. You could correlate this to certain conditions of nervous tone if you wanted to. Mint then is only stimulatory insofar as it moves stuck liver qi. When stuck liver qi moves, a person feels suddenly like they have a lot more energy because their energy is no longer bound up. But if a person does not have bound up qi, when they take mint, particularly a lot of mint, it's not going to be stimulating at all. It's going to be sedating and possibly to the point of fatiguing, depending upon how much somebody takes. Humoral medicine addresses this in a similar way to Chinese medicine by saying the effect of something depends upon the tissue state and constitution. Modern Western herbal medicine tends to address this by saying that the herb is kind of biphasic, meaning that it is both hot and cold at the same time. And I've seen this in a number of different places with a number of different herbs. Mint's a primary example, different kinds of mints. Yarrow is another example where something is described as both hot and cold, warming and cooling. But I have real issues with describing things in this way. An herb cannot be both hot and cold at the same time. If you say that it is, you have suddenly lost explanatory power. This means that your herbal theory is not descriptive enough because you've put the effect that the herb has upon the body entirely upon the herb. So being simultaneously stimulating and sedating or warming and cooling becomes a feature of the herb itself. And then it becomes just a peculiarity of a particular herb to remember. But if you say that, then you don't know why it does what it does, or how to know what it will actually do in you or the patient who takes it. So it's much more descriptive to say it's not a quality of the herb. The herb is not both hot and cold, and it does what it does depending upon what the person needs. Rather, whether it's hot or cold, or stimulating or sedating, depends upon the pathology of the person. In other words, you need to describe the person more and the disease state more and the herb less. And you could say this is kind of saying the same thing, but it's really not, because in those cases, again, the pathology of the person has not been adequately described. So we've talked about classical humoral herbalism and classical Chinese herbalism. Now let's talk about modern Western herbalism. First of all, we have to be honest. Modern Western herbalism is modern. Humoral herbalism died out with modern pharmacology. So this left a giant hole in the field of Western herbalism that lasted for a couple of hundred years. And yes, there were efforts to fill this gap, like the eclectics, but they died out too. And yes, to be sure, there were always family traditions of herbalists and practitioners, for example, in isolated communities. But we have to be clear that those practitioners, while they undoubtedly had very nuanced personal experience that they passed down, they did not have access to education in the same way as humoral physicians did. And certainly not like the Chinese physicians did, and still do. Now, one could make the argument that actual rigorous education in humoralism had been in decline anyway, and doctors of later times were just generally kind of bad compared to the Salerno school and the Islamic Golden Age, for example. And that this is why you had crazy shit like heroic medicine, where people were doing bloodletting for everything and a lot of people were dying. And there is a lot of truth to this, to be sure. But still, the education was far different. Even if the doctors really didn't use their education or put much faith in it, because chemistry and anatomy were calling into question all of the underlying theoretical foundation. Nonetheless, the education was still there. And this means that their respective knowledge bases were vastly different. For example, a local self-taught or family tradition herbalist would have had knowledge that they got from personal experience. They would have knowledge that they got from elders. They would have had anecdotes. And at the time, they might have had access to a limited number of books. But remember that not much was actually probably accessible to this person. These books, old herbal texts, classical theory, they would have been in Latin, or at best, Middle French. There were Middle English manuscripts, but they were in abbey libraries, and the rural herbalist is just not going to have access to that. So there wasn't really that much medical knowledge floating around for the archetypal herbalist in the woods. And you could say, from the modern point of view, well, stick it to the man. You don't need that. Intuition is your guide. And scholasticism really restricts your thinking by putting you in a box. But the reality is, a classically trained physician would have had access to a wealth of information the average herbalist wouldn't have, and the modern herbalist still doesn't have. We're talking tomes and tomes of theory, case studies, herbal experiences, materia medica, formularies, etc. And not just from their contemporaries. They would have conceivably had access to works going back hundreds, if not 1,000+ years. The Chinese physicians, by contrast, had it even better. Herbal medicine was a literati tradition. If you didn't pass your exams to become a bureaucrat, or didn't want to, you could always become a physician. And being a physician was a highly respected scholarly position. And that meant that not only did you have to pass a rigorous exam, but once you did so, you now had access to an enormous amount of recorded human experience. A person in 1900s China would have had access to 2,000 years of recorded medical texts on theory, herbal formulas, combinations, case studies through all of the major herbal movements. And if you're confused by a case, you can find the answer somewhere. And so, by contrast, if someone thinks that they are personally eclectic and doing their own thing and they don't need any of that information, they don't need access to those texts, they don't need access to that theory, that's really pretty arrogant and really dangerous to you and to your patients, especially if you are treating complex patients, complex patterns, and using dangerous herbs. And I've seen this perspective before, that you should just trust your intuition and don't rely too much on theory. The good herbalist is a kind of intuitive healer. And that is really, really dangerous. And this is not to say that intuition in medicine is wrong or ineffective, but let's define what intuition is. I think many people think of intuition as a kind of hidden transmission of knowledge. And I think that's fine in some domains like shamanism, spiritual practices, communing with nature and spirits. That's all great. But when applied to herbalism, the stakes are just way too high. When you're putting a powerful drug into a body, to decide which one to take based on intuition could be considered criminally negligent. And I have two stories about that. The first one is someone doing muscle testing to decide which herbs to take. This was somebody that I worked for at one period of time. And all of their bottles were covered up. They couldn't see what it was. One was the formula that they were taking and doing very well on, and the others were random herbs off a shelf. And they were convinced that they would be able to pick the right one and in the right dosage. So the labels were all covered up. They had no idea what they were taking, and they based their decision on muscle testing. And based on muscle testing, they determined that they needed to take 60 grams of scorpion. Now, scorpion in Chinese medicine is used in very small doses, like 2 grams, and only in neurological conditions like epilepsy. It's not something you just want to willy-nilly grab off the shelf and take. And that being the case, 60 grams is very toxic and might kill you. So that's a cautionary tale. You can get away with that if what you're taking has no consequence, if it doesn't really have any kind of real healing effect. But you can't get away with that if what you're taking is potentially toxic. The other story I have is of a practitioner I was taking a class from who was teaching the class. This is a very well-respected herbal teacher who said that they prescribe herbs to patients based upon what the fairies tell them. Again, this is criminally negligent. So, that kind of intuition cannot be applied to herbalism. So, if that's not the kind of intuition we're talking about in herbalism, then when we say that, when we do talk about intuition in herbalism, what are we talking about? Intuition in this sense is an internalized pattern recognition that operates prior to analysis. And this means that the practitioner has actually seen the pattern often enough to be able to recognize it. So this means you have to see thousands and thousands of people, thousands and thousands of cases to be able to get an intuitive hit that, oh, this pattern looks familiar, regardless of what I think about it, regardless of how I analyze it. There's something intuitively familiar to it because I recognize the pattern of it. So, we can equate this to music, right? You need to train in patterns. You need to really practice the basics. You're not going to be doing solos on a guitar if you've never really practiced it before, even if you know the music is inside of you. So if we're going to say that intuition in herbalism is safe, it means that this person has either treated 10,000 patients, seen the pattern enough, and absolutely knows what they're doing, or the practitioner just isn't treating conditions that are very serious, or they're just not using strong, risky herbs, or they're not using herbs at classically medicinal doses. It's got to be one of those. After all, as Paracelsus said, the poison is in the dosage. And another way of saying this is, if something doesn't have the potential to hurt you, it doesn't have the potential to help you. And we can get away with functioning on intuition if we're using something like echinacea or elderberry for a cold, but we can't get away with intuition when using heavy-hitting herbs like processed aconite to treat congestive heart failure. You just can't ethically do that. Now, what herbalist is really treating congestive heart failure where the patient is in the hospital? I know of some that are really good and willing to. I'm not, and I wouldn't pretend I'm anywhere near good enough. And I'm willing to bet that most anybody listening to this isn't either. So at any rate, getting back to modern Western herbalism in general and the history of it, modern Western herbalism finds itself in a period of reinvention right now. And I say finds, not found, because that process will really be ongoing for the next 500 years. You need enough accumulated knowledge within a new theory system. And being in a period of reinvention, it's had to look to the past and also towards other systems. Because when it looks back to its own past, it unfortunately just can't look very far. It can't look back to humoral medicine very easily. It can't go back to the classics of its own tradition, and that's because those classics aren't really accessible. The majority wasn't and still isn't translated. The average eclectic herbalist in the woods is not reading Latin or ancient Greek or medieval French, and to say nothing of Arabic. And even Sina's magnum opus on humoral medicine wasn't translated into English until the 1990s. So about the farthest you could go back was the eclectics of the 1800s. And it does seem that a lot of theory is based off of the eclectics, in particular the idea of the 6 tissue states. But the 6 tissue states aren't really enough because while they describe generally what a condition might be, they don't have much in the way of named disease patterns as far as I know, and not really well-defined treatment strategies. And this is why you see a lot of borrowing from other traditions, particularly from the Chinese. So it's not uncommon to see a mix of the 6 tissue states with Chinese disease concepts like spleen qi deficiency or liver qi stagnation, etc. And in that borrowing, it's important to point out that those borrowed terms are not always borrowed correctly. Things get lost in translation. You also see a lot of mixing of tissue states and imported terms with biomedical concepts, such as inflammation, endocrine function, nervous system tone, etc. So what this means is that it's not as codified as other herbal systems are that have been in use for 2,000 years. And this can be a good thing, or it can be a bad thing. Cultural upheaval is how societal transformation and innovation happens, and whether it's a good or bad thing depends upon how it plays out, and this is why I think it'll take at least 500 years for it to really step into its own for us to know. And I get it. I know that this opinion will probably piss a lot of people off, but I've been in a number of different worlds: classical Chinese medicine, classical humoral medicine, and modern herbalism, and being in those worlds, that's just how I see it. So, getting back to the real point of this, modern Western herbalism puts several systems together that look related but aren't. It takes the organoleptic qualities of flavor from Chinese medicine, but instead of saying that the temperatures of herbs are correlated to flavors, it instead says that they are caused by them. At least I've seen this a lot of places, and I know that not everybody says this, and there's not 100% agreement, of course, among modern Western herbalists, but I've seen this enough times to comment on it. And saying that temperature is caused by flavor is a modern pharmacological approach, whereby one looks at constituents like bitter alkaloids, or looks at how acrid herbs activate V1 receptors and stimulate the sympathetic nervous system, or how sweet flavors promote anabolic profiles or whatever, and then uses the molecules behind that as mechanistic justification of how an herb acts the way it does. It seems the same on the surface, but it's not. Correlation is not causation, which means there are always exceptions, and that you can't apply a flavor as a surefire way to know what an herb does. Then, modern Western herbalism takes the concept of temperature from humoral medicine, which is to say that warming is not really a temperature, although it could be, but really more of a quality of system restoration, so temperature is kind of an effect. And it maps this to modern physiology by saying that warming herbs are stimulating to such things as glands, tissues, or nervous tone. So, for example, an herb that stimulates gastric secretions could be said to be warming because it is stimulating, even if the subjective experience of the patient is one of calming, relaxing, or downregulating. For example, if a patient is bothered by digestive complaints, and those digestive complaints manifest with symptoms that are hot in nature, you could still give a warming herb, because warming in this context means restoring, not actually warming. And this, to my mind, is the problem of conflating the classical humoral definition of warming as restorative with a kind of pharmacological effect of an herb as having a warming quality. And then you also see Ayurvedic herbal concepts combined at certain points too. This is then combined with the physiomedical tissue states of the 1800s, such as the 6 tissue states. And lastly, flavor, which oftentimes dictates temperature, is then mapped to specific modern pharmacological effects, such as anti-inflammatory, antibacterial, cholagogic, etc. And you'll notice that such concepts as anti-inflammatory, antibiotic, sedative, cholagogic, these are not humoral concepts, nor are they Chinese medical or Ayurvedic concepts, but are wholly modern materialist medicine concepts. So modern Western herbalism seems to be taking a grand unified theory approach, which is in part due to needing to fill the information gap, and it's also wanting to speak a general contemporary medical language that the patient is going to be familiar with, and also wanting to be seen as legitimate by the Western allopathic medical establishment, which, of course, every herbal tradition wants. So that's completely understandable. Now, to what extent this creates a robust system, that's for time to tell. The system has a lot going for it. It's got some problems too, like anything else. The system is certainly more flexible than classical herbalism, and this can be both a positive and a negative. But again, in all fairness, it's going to take probably about 500 years for modern Western herbalism to codify into a singular coherent system. But, also in all fairness, the same could be said for Western allopathic medicine too. That's still very much in its infancy, still really trying to work the bugs out, and really great at describing disease, not so great at doing anything about it. So that is to say, Western allopathic medicine, in as much as it describes itself as a monolithic, inarguable truth, is still very much in its infancy. So there you have it. A quick comparison, or by now a long comparison, of how three major herbal systems categorize herbs. And probably the most important part of this comparison is looking at how these different systems classify their medicinals and how they classify their medicinals directly relate to their own theory and how that's not translatable. Herbal classification and theory are inseparable, to the extent that theory dictates classification as much as observation guides theory. So while there are universal effects, there are not universal labels and descriptions. What's hot for one theory is cold for another. Why something works in one theory is completely different for another and described in a completely different way. The flavors of the same plant are different from one system to the next, and even in the same system across time. And this means that you have to be really, really careful about mixing metaphors and taking the language and description of one system and importing bits and pieces of it into another. And this brings me to my final point. We all want to start learning herbs by starting with herbs. And this seems completely natural, but that's actually a very bad way to do it. It's both really confusing and really time-consuming. Good herbalism is rooted in theory. Learn theory first. The quickest and best way to become an expert herbalist is by studying theory and seeing that theory work enough times in clinical experience. We're talking hundreds of patients a day, not 100 patients a year. So starting with herbs first and trying to figure it out from there is really, really difficult. And you're going to come to a lot of false conclusions, ideas of what works and doesn't because it worked for one person, or you read in a book someplace that this is what it did, and it won't for the next 5 or 10, and you'll be very frustrated wondering why. So my advice would be to anyone starting out, pick your theory first. And when you do so, be very intentional in which one you're picking. And remember, all of this is just my opinion, and I'm sure a lot of what I said is going to be a very unpopular opinion. And if you don't agree, that's no problem at all. There are plenty of herbal teachers and approaches out there. I'm just one voice talking into the wind. So there you have it, 3 systems: Humoral Herbalism, Chinese Herbalism, and Modern Western Herbalism. Now, as a final note, I'm going to point out a couple of specific examples of glaring differences. These can cause confusion if you're not aware of them. And honestly, they just bug me, so I'm gonna put it out there. Next, the bitter flavor has a somewhat complicated history in modern Western herbalism. The eclectics generally thought it was warming because it stimulated gastric secretions and overall GI function. So to them, bitters were stimulant digestive tonics. This concept was imported into later herbal thinking. Over time, though, a different conception of the pharmacological effect of bitter emerged, where bitter was seen to be anti-inflammatory and had anti-irritant qualities, and these qualities are better described as being cold. And this led to the later supposition that bitter is biphasic, being both warming and cooling. However, again, something to keep in mind is that overly descriptive herbal energetics can result in being underly descriptive of the human body and theories of it. So this is due to the fact that you're ascribing qualities to the herbs that are better defined by individual tissue states themselves. In essence, again, you're taking descriptive power away from your theory of physiology and placing it upon idiosyncratic herbal description. The best way to explain this is with an example. In classical humoral medicine, small amounts of bitter can increase the digestive fire of the stomach. But they only do this because the bitter flavor in humoral medicine terms cuts through turbidity in the stomach, like turbidity of phlegm. This phlegm blocks the calor instrumentalis of the stomach. You can think of it like burned char on the bottom of a pan. Your pan doesn't conduct heat well if there's a thick layer on it, so you have to scour it off. And that's what bitter does in the stomach. But if you don't have turbidity in the stomach, that bitter isn't going to improve digestive fire in the same way. So the effect then doesn't depend upon the herb, it depends upon the person. Now, you could say that's the same thing at the end of the day again, but it's not quite, because the cases in which you would grab a bitter herb in one system versus another are a little different and can be contradictory. So just keep that in mind. Now, talking about physiomedicalism and the 6 tissue states, I know this is very popular among some practitioners, which is fine, and I'm going to leave my own opinions aside. However, I will point out a challenge to one of the assertions made in favor of it. The explanation goes, Western herbalism, so we're talking about classical humoral herbalism, was based on the 4 elements of hot, cold, wet, and dry. And this held for like 1800 years. However, in the 20th century, this way of thinking, this way of describing, was deemed to be inadequate. Hence, the adoption of the later physiomedical eclectic model into modern Western herbalism. And it's said that this is superior to classical humoral herbalism because it adds the tissue states of tension and relaxation. And I have seen people go so far as to say that Galen's humoral model was flawed. And I don't buy that. I think it's quite arrogant to say that Galen, the personal physician to the Roman emperor, the great systematizer, the great codifier, who was well aware of the Methodist medicine of the time from which tension and relaxation as tissue states come from, somehow missed this crucial insight. And also that this crucial insight was somehow not caught by the massive intellectual scholar physicians of the Islamic Golden Age, and that the Salerno school somehow never caught on to it either. So for 1800 years, there has been this flaw. And also that it took the pioneering Americans to finally make it better. No way. you can only say that if what you're doing is not actually classical humoral theory, and that you're practicing something else, something more simplified. If you're doing that, then maybe that's true, but that's not classical humoral theory. And also, keep in mind, tension and relaxation, they're not missing from classical humoral theory. They are implied within the combinations of hot, cold, wet, and dry. Therefore, you don't actually need them as standalone tissue states. So, I'm not saying any of this to piss anybody off. I don't care what theory anybody follows. I'm only bringing this up as a point of comparison because these claims are often made in the modern herbal approaches, and I think that it's just quite unfair to classical humoral theory, and I don't think it's at all valid. So there you go. A video that was supposed to be very short, again, turned out to be very long, but I did my best to stop talking. So, in conclusion, my final parting advice is don't start with herbs. When trying to understand herbalism, don't start with herbs. Pick your system first. Pick your theory first. Because the theory that you pick is going to be the lens that colors all of your understanding of herbs and what they do. And we tend to think like we're coming at herbalism from a modern point of view relatively agnostic. We don't have a background theory that we're operating out of. That is wholly untrue. We have a default way of understanding the world, and understanding how something like herbal medicine plugs into it. We have an underlying, already built-in ideology, even if we claim we don't. That ideology is absolutely coloring the way that you view herbs and the way that you view the human body and how they interact together. So, if you want to be effective at what you do, really understand that and really be intentional in the ideology that you pick. What do you resonate most with? What's the one that you can wrap your head around? What's the one that you can, that you feel better practicing in? So, good luck.